in Harrisonburg, Virginia. President Obama and most in Congress and the media keep telling us that we can keep our current health care insurance and won't be forced into a single-payer system. However, on page 16 of the bill before Congress, lines 11 to 16 clearly state that the insurance companies cannot enroll individuals if the first effective date of coverage is on or after the first day of year one. In addition, lines 22 to 26 of the same page says that there can be no change in the terms of conditions, including benefits and cost sharing from those in effect as of the day before the first day of year one. If the bill forbids changes in benefits and new enrollments in private insurance over the new system, once the new system goes into effect, would that not eventually lead to bankruptcy of the health insurance industry, essentially resulting in a single-payer system? And if not, why?
Well, that's a very good point. I think that a lot has been made of the idea that you'll be able to keep your private health insurance. First of all, as the physician has pointed out, that will not allow somebody to enroll in any current plan in ensuing years. But here's the greater concern that's not even mentioned in the bill, and that's this. Because we're setting up this health insurance commissioner, the HCA commissioner, that individual is going to determine what each health insurance policy offers. And as a result, if your current plan doesn't meet the requirements of the health insurance commissioner, you're not going to have that plan in the future because they won't be allowed to offer it, and you won't be able to, you'll have to pick something else or keep your current plan but with what might be some significant changes to it, including changes in the price of it. You get private health insurance through a large plan that I support being able to go into, or whether you are a major employer and are offering health insurance to your employees. The federal government employees receive health insurance based upon a large number, scores of different plans that are offered by dozens of insurance companies, and not the government, but the individual employee makes the choice of the plan that they want. The government pays a maximum of 72% of their employees' health insurance. The employee pays a minimum of 28%. If the plan they pick is a basic plan, they can get it for their 28% contribution. But if they want to pick from many, many other plans, they pay the additional amount. But these are all private health insurance companies that are competing with each other for each individual employee to do that. And historically, the federal government health insurance costs have increased at a slower rate than private health insurance. So I think that would be a great reform to have for all people, to have insurance companies competing to get their choice. Right now, most employers pick one plan, and you get that plan. And I think that would be a big improvement. Now, veterans are very unique. They've served their country. Some of them have wounds or disabilities that they incurred in the service of their country, and they do have a separate health care system. Some of them like it, some of them don't. Some of them use it and complain about it to my office. Some of them use it and are very complimentary of it. We help all veterans who have needs and issues dealing with the Veterans Administration. But I will tell you that it's a very political process that each year veterans come to the Congress and say, we need to increase that, we need to improve this, and so on. And veterans, because I think they have earned it, get that good coverage through the VA. But they also have a choice of going to private hospitals, and many of them do. They'll go to Augusta Medical Center or to Rockingham Memorial Hospital. They get a choice in their health care, and we need to make sure that we maintain that, not go the opposite direction. There's no mandate on any private insurer related to what they provide or don't provide to a veteran. The veteran gets to choose. Maybe they earned it through employment with a company. Maybe they have some other choice. But many, many, many veterans do not go to the VA Medical Center. Finally, let me say that I share your concern about people who don't have health insurance. But I think the best way to do that is to create more choices for people. If you ask people in general what their two greatest concerns are about health insurance, one is the cost. No question about it. It's going up at too fast a rate. far higher than the rate of inflation. But the other is the choices that they want to be able to make. And in my opinion, this is taking choices away from people, far, far, far more people, than it will create opportunities for people who don't have health insurance. And therefore, in my opinion, we ought to take a different approach. Now, with regard to the issue of medical liability reform, I've talked to many, many, many physicians and hospitals who will freely acknowledge that they practice what's called defensive medicine, that they order up tests and sometimes even procedures that they don't think are necessary for the course of treatment for that patient, because they want to have in that file, if they're ever sued, the evidence that they tested for everything. Now, that's not a good thing. That costs tens of billions of dollars every year in unnecessary tests and services. It adds to everybody's health insurance. It adds to the cost of the government programs that already exist. And it adds to the increasing cost of health care, which, as we've already said, is going up at too high a rate. So medical liability reforms that cut down on defensive medicine, I think, should be a significant part of any health care reform. The President of the United States has said so, but the plans that are working their way through the Congress don't contain any, and they should. And I think that that is another example of something that should cause us to start again on this process, rather than simply say, okay, that's nice, but we're going to skip over that because some groups of people are against medical liability reform. I had the opportunity to participate at the table in the final negotiations of that bill. Many, many, many changes were made at my request in order to get my support, and they all, in my opinion, significantly improved the bill, cut down on subsidies, and made the bill, I think, far more effective and better for my farmers who don't get much of those subsidies. But I didn't have the support of the votes to eliminate the subsidies. If I did, I would vote to eliminate them entirely. Now having said that, the current bill that we're talking about here today has a huge increase in the federal deficit, as stated by the Congressional Budget Office, which pointed out that it does not achieve savings. It instead costs more. And there is more than $1 trillion in tax increase. In addition to the tax increase we've been talking about here, there is a tax increase on wealthier people who are primarily small business owners. So again, they'll get hit twice with this if they're not providing health insurance today. That will have an impact, in my opinion, on jobs at a time when we have a shortage of jobs in this country and rising unemployment. So I think this is a very bad approach, and I don't think it's very comparable to the Farm Bill.
Well, thank you very much for your time, and I'd be happy to talk to you more about this.
I'd be happy to talk to you more about it.
And thank you all for your time as well.